Hi, everyone. So today we are going to be talking about herniated disc and neurological testing. So in the last video, we talked about what herniated disc were. Today we're going to talk about how to diagnose them. These are some very simple tests that you can do, and these are just the very beginning of testing for the herniated disc. What happens is if these are positive tests, you would then send the person out for like an MRI and get more testing done. So let's go ahead and get started. These are basically the notes of what we're going to be going over today. So these are neurological tests. And the first one we're going to look at is the cervical straight compression test. And like it says there, you just gently push down on the person's head, and it should say pain. Pain will radiate into the arm on the affected side. Normally what you'll do is you will follow that up, especially if this is negative. If this is very painful, you're not going to do any more tests. But what you're going to do next is you're going to do the lateral flexion compression test. Also, it has a few different names. So what you do is you put the patient's head to one side. Some people like to put the head back and then rotate and then press down. But you can put the head to one side and press down. That will close down the foramina that are in the spine, which we're going to be looking at in just a minute. And if you get the pain into the arm, that's how you know it's positive. The distraction test is not a test that is done for cervical spine problems or cervical herniated disc. Well, actually it is. What you do is you pull the head up, and if the pain goes away, what you're doing is you're opening those intervertebral foramen. IVF stands for intervertebral foramen. All right, and actually I'm going to call it foramina, and that will actually put it will decrease the pain. Then you have the herniated disc from the lumbar spine. This is the straight leg raise, like it says here. The patient just lays on their back. You would lift their leg, so you put one hand like on the ankle to support their leg, and one hand on the knee to support their knee. Lift the leg while supporting the ankle. And people do this in all different ways. So the knee is kept straight, and you look for pain into the leg that goes past the knee. So let's go ahead and take a look at these now. So once again, if we're looking at the intervertebral foramen, we have the opening here, and the nerve is coming out. And what happens is when we do these tests, we're actually going to be pushing down. We're going to close off this space in here. We're going to make it smaller, which put more pressure onto the nerves. And as you can see here, as you put the pressure on the nerves, you're going to start to get pain that goes down into the arm or leg. What you're looking at here is the spine from the side. Okay, these are the bones. The blue is the disc. Okay, and these are the nerves. So as I do these tests, I'm pressing down on this area here, which can put pressure on the nerves and cause pain. Okay, you can see it again here. This is the bone, and this is the bone. This is the opening called the intervertebral foramen. And in the intervertebral foramen, normally the nerves come out. This is a disc, and this disc is herniated. That's what you're looking at right here. And it's putting pressure on the nerves. If you had a herniated disc that's this bad, this person's probably going to be in pain anyway. So you probably wouldn't even bother doing these tests because it would be too painful. But if not, you would do the test just to see if we're getting pressure on the nerves to look for a herniated disc. So here's the first video we're going to look at. I actually have the sound turned off on this because
yeah, be careful.